Welcome back. Since you already have experience guiding patients through goals of care discussions, I won't cover everything. Instead, I'll focus on answering common patient questions about kidney therapies. Some of these questions should be answered by nephrologists, but knowing the answers may be helpful in guiding some decision-making conversations. Patients often ask about their current kidney function. You can explain that their kidneys are damaged, usually due to conditions like diabetes or high blood pressure, and are now working at a reduced percentage of their normal capacity. A helpful approach is to compare their eGFR to normal kidney function. For example, you might say, normally kidneys function slightly above 100%, but yours are working at about 25%. Some may ask what creatinine is. You can explain that creatinine is another measure of kidney function. Higher levels indicate reduced filtering ability. You can compare their creatinine levels to normal values, explaining for a person with normal kidney function, creatinine is typically less than 1 milligram per deciliter, but yours, for example, is currently at 2 milligrams per deciliter. Many patients also ask if their kidney disease can be cured. It's important to clarify that chronic kidney disease is usually irreversible, especially when caused by chronic conditions such as diabetes or high blood pressure. However, certain factors, such as proteinuria, may improve with better disease management, lifestyle changes, and medication. You can also refer patients to their kidney doctor for further discussion. Patients routinely ask what they can do to slow the progression of CKD. You can explain that to slow the progression of kidney disease, patients should focus on managing contributing conditions like diabetes and high blood pressure. Maintaining a healthy lifestyle, including regular exercise, a plant-based diet, and proper hydration can also help. It's important to educate patients about medication risks, particularly avoiding non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, and Motrin, which can worsen kidney function. For detailed guidance, encourage them to discuss these strategies with their kidney doctor. Making decisions about kidney therapy can be challenging for patients. According to KDIGO guidelines, early decision-making, when eGFR falls below 30 milliliters per minute, is linked to better survival rates. It also allows time for preparation, such as creating a fistula for dialysis access, which can take several months to mature. Early decisions help prevent crash dialysis starts, which are associated with poorer outcomes. If a patient isn't ready to decide, explore their concerns, fears, and goals. In some cases, taking a deciding not to decide approach and revisiting the discussion at a later point, for example when eGFR reaches 20 milliliters per minute, may be appropriate. Common symptoms that indicate dialysis may be needed include metallic taste, leg swelling, shortness of breath, fatigue, nausea, vomiting, loss of appetite, muscle cramps, and itching. Dialysis is generally recommended when kidney function drops below 15%, particularly when symptoms become severe. Patients may ask if starting dialysis needs preparation. Yes, preparation is required when starting dialysis, and it is important to inform patients about these timelines so they can plan ahead. For hemodialysis, an arteriovenous fistula is the preferred access option, but it requires 3 to 4 months or longer to mature. In some cases, the procedure is done in 2 stages. For peritoneal dialysis, a PD catheter must be surgically inserted, followed by a 2-week healing period before use. The AV graft, which is the less desirable option, takes approximately 2 to 4 weeks to heal. Patients often have concerns about CPR outcomes, dialysis effects on quality of life, treatment options, and transplant eligibility. For older adults with CKD, in-hospital CPR survival rates are low, with 78% dying within the same hospitalization, with 15% of survivors requiring nursing home placement. Patients may ask if dialysis will help them feel better. Dialysis helps manage symptoms like swelling and blood pressure control, but it does not always improve overall well-being, energy levels, or mobility. Patients may ask which dialysis modality they should choose. Choosing between clinic and home dialysis depends on individual preferences. Clinic dialysis provides professional oversight, while home dialysis offers flexibility but requires self-management. Home dialysis also may offer a less restrictive lifestyle. For those considering a kidney transplant, Eligibility depends on an evaluation at a transplant center, assessing overall health and medical history. Encouraging discussions with their kidney doctor can help patients make informed decisions. Patients on dialysis must follow a carefully planned diet and monitor their fluid intake. To avoid complications, they should limit potassium, phosphorus, and sodium. Tracking fluid intake is also important. Excess fluid can cause swelling, weight gain between dialysis sessions, and increased strain on the heart, potentially leading to breathing difficulties and blood pressure changes. Dietary restrictions are similar for patients choosing conservative kidney management, but fluid intake limits are generally less strict since they tend to maintain urine output. Patients who choose conservative kidney management generally do well until their eGFR becomes very low. At that point, they may experience an acute uremic decline, leading to symptoms such as poor appetite, difficulty walking, loss of appetite, drowsiness, and confusion. Please counsel families about the acute uremic decline and the need for hospice referral at that time. Unfortunately, many dialysis patients pass away following acute illness without clear advanced care planning, which can lead to burdensome interventions. Early discussions about goals of care can help align treatment with patient preferences. The CKD-EDU study team is grateful for your participation. We hope that these videos were helpful and that you feel prepared to have kidney therapy decision-making conversations. We encourage you to read the manual and refer to your cheat sheet when necessary. Thank you.